So what we did was we took patients who have early stage breast cancer, who have been treated with doxorubicin, and these patients were anywhere from essentially a few months out to up to 6 years out, and all of them had normal ejection fraction as we normally define it, so 50% or more. And what we did with these patients was we feel that ejection fraction is a poor marker of what we call preclinical myocardial injury. And what we decided to do is that we would test these patients with resting echocardiograms, again to assess their ejection fraction, but this time instead of by two-dimensional, by three-dimensional ejection fraction, as well as to measure their speckle tracking strain function, which in various cardiomyopathies has been shown to be a more sensitive marker of myocardial function. We also evaluated these patients with cardiopulmonary exercise testing, which has been shown to be inversely related to cardiovascular outcomes. And what we found was that by resting function, or when you did the resting echocardiogram on these patients, the patients who had been most recently treated with doxorubicin actually showed impaired myocardial function by strain as compared to the longer-term survivors and as compared to the controls. We also found that their three-dimensional ejection fractions were also diminished as compared to both those two groups. Even more interestingly, we found that all breast cancer patients had significantly more than 20% decreased VO2 maxes compared to healthy controls. And so we think that when you look at strain function, when you look at cardiopulmonary exercise testing, these can be more sensitive markers of preclinical myocardial dysfunction that two-dimensional ejection fraction does not detect.